Welcome to Norwich Medical School. My name is Dr. Susan Madden. I'm the admissions director in the medical school. And I'd like to spend the next 20 minutes giving you a little bit of a greater oversight into the school itself, the courses that we offer, and really some of the sort of key features of the course, which will hopefully help you decide whether to study medicine with us at Norwich. So welcome, and thank you for taking time to find out a bit more about us. The pictures on this slide are really just a sort of snapshot of some of the facilities we have within the medical school. We are split primarily over two main buildings. The building in the middle at the bottom with Norwich Medical School over the door, that is our core building on the main UEA campus, and this is really where you do a lot of your small group teaching, such as problem-based learning, consultation skills. A lot of staff's offices are also based there. But as you would expect, we are a modern, vibrant medical school, and we have a lot of other facilities that our students access. So as you'll see on the bottom right-hand corner, that is one of our clinical skills suites room, and that's based in our Bob Champion Research Education Centre, which is located next to the Norfolk and Norwich University Hospital. Above that picture is the atrium of the Bob Champion building. And on the top left-hand corner, they are some of our research laboratories, again, based in the Bob Champion Research building, where students can go and spend time doing intercalated degrees, as well as finding out more during their student-selected studies. The picture in the middle at the top, that is of our anatomy suite. We do undertake dissection within the Norwich Medical School. It is a core part of our curriculum, and all students do need to take part in that. So as I mentioned, we are split across two main buildings. For those of you who have had a look a little bit about UEA and the Norwich Research Park and how we're located in that, over on the top left-hand corner, that is very much UEA's main campus, where the sports park, student union, a lot of the student accommodation is based there as well. And that is where we also have our main building, where we have our problem-based learning, as I mentioned earlier. And so students really are sort of on the centre of the campus and are able to access all of the core facilities. However, we are part of the Research Park, which gives us access to an amazing group of academics who work on a huge range of projects. It's a short walk across our sports fields in the middle, and here you will see the Bob Champion Research and Education building, as I mentioned earlier. And one of the things that you'll really notice is the physical location to the Norfolk and Norwich University Hospital. One of the benefits being so close to our clinical colleagues is that we are really able to integrate clinical practice with campus-based teaching, and it just means that practically it's a very easy and a very close relationship because of the geography we inhabit. So at Norwich, we have two primary medical qualifications within the school. We have our 5-year programme, which is the MBBS Medicine. This was established in 2002, so we are very much an established medical school now. We've been running for 18 years, and that's very successful. We also offer the MBBS Medicine with a gateway year. Now, this programme is very much designed for our widening participation students. So we do take students who have slightly lower academic grades, both at GCSE and A levels, but they must meet our contextual criteria. Now, with that gateway year, our students spend time undertaking additional science and social science skills, as well as doing work experience within the GP and secondary care placements, and very much developing some of the confidence and the additional skills through problem-based learning, small group work. So then as you complete that year, you then join our 5-year programme, and you're really ready to go with the 5-year course. So how does it all work? How does our course operate, and what makes us slightly different to, say, some of the other medical curriculum out there? So we are what we call an integrated course, and we take a modular approach. When we talk about being an integrated course, it really means that we look at systems at a time. So, for example, you would spend a period of time looking at cardiology, the cardiac system, and during that module you look at the anatomy of the heart and the cardiac system, the pathologies, physiology. You will also look at different treatment techniques, and then during that time as well you will spend time both in primary care and secondary care. The way that it works is that you will be able to really apply the knowledge that you gain through your campus teaching within the clinical setting immediately. Now, one of the things that we also do during primary care teaching is you will be able to meet patients with those clinical conditions as you go through the course, and then in the secondary care placements you're able to see much more the acute side of treatment, and the consultants undertaking their activities as well. We have what we call vertical themes throughout the course. So, for example, themes such as medical research. You start your medical research theme in year 1, understanding evidence-based medicine, looking at different types of evidence, how to critically appraise, and you build on that throughout your 5 years through clinical audit. You will have opportunity to take part in research through your student-selected studies, as well as potentially an intercalated degree. So by the time you finish your 5 years with us, you have all of the attributes needed within that particular theme. The other aspect of our course is we do have what we call a spiral curriculum. So that means that you very much revisit and build on some of the skills that you develop. So, for example, in year 1, you're introduced to many of the core concepts around the issues such as care of the elderly, death and dying, and these are very much revisited as you go through your 5 years. So it is very much a spiral curriculum, and you build on your knowledge that you gain throughout. So in terms of the topics that we cover, in what order we do them, so in year 0, as I mentioned, this is our gateway year, and this gives you an opportunity to consolidate some of the knowledge you may have already gained, as well as look at things such as clinical medicine, issues in healthcare. As you move into year 1, we look at the fundamentals of science of medicine. As you would expect, we need to ensure that you have got that basic science and social science in place. So as I mentioned, subjects such as death and dying, how people age, things like immunology, all of those issues are covered in year 1, so that they are revisited as you go through your course. But also in year 1 as well, you look at the musculoskeletal system, so issues such as orthopedics and rheumatology. Then as you move into years 2 and 3, you carry on looking at the different systems across the body. So by the time you finish year 3, you really have a good grounding of all of the different systems in the human body, as well as the common pathologies, treatment techniques, pharmacology. So then as you move into year 4, into the more complex areas, you really have got that basis to understand those in more depth. So as I mentioned, by the time you get into year 4, this is really where we are looking at the, as I said, some of the more complex areas of medicine, such as oncology, palliative care, reproduction, mind and body is psychiatry. And at the end of year 4, our students undertake an elective period. This is the traditional elective where most of our students have an opportunity to go overseas and spend a period of time in a different healthcare system, healthcare setting, understanding some of the different cultural issues surrounding healthcare in different countries. As you return in year 5, this is the consolidation year. You will spend most of this year in secondary care, working very closely with foundation doctors, getting you very much up to speed, preparing yourself for when you not only take your finals, but as you move into being a foundation doctor. And also at the end of year 5, once you've completed your finals in March, you also have an opportunity to do one final elective. This tends to be in the UK, and students often use this as a time to spend a clinical attachment in an area, a speciality that they might have a particular interest in. So one of the core features of our of the MBBS and of the Gateway Year is that we do undertake a lot of our teaching in small groups. So whilst you still do large group lectures and seminars, as you would see in a traditional course, our students also spend a lot of time in small groups. So when you start the academic year, you will be placed in a group of typically 10 students with your peers. We will allocate you to your group, and you stay with that group for the academic year, where you undertake problem-based learning with them. You go to your primary care placement, things like consultation skills and anatomy. And then obviously when you go into secondary care, you are also in small groups, although we try and change your small groups when you are in secondary care. One of the big advantages of spending time as a small group is a lot of the learning and teaching styles that we need you to engage with are around group discussion, case discussion, where you have an opportunity to work as a team, where you have an opportunity to lead your group, your presentation skills, your critical thinking, all of those skills that are essential to be a successful doctor. The other big advantage from our perspective as well is that you will work very closely with a tutor in your problem-based learning group, but also with a GP tutor in primary care. And they have an opportunity to get to know you. They see you week in, week out. And if we get to a position where we are concerned whether you're keeping up with your studies, we're very much able to take proactive measures there and then, rather than waiting until potentially the end of the year when you undertake your summative assessment, which may then reveal problems. When you are working in your problem-based learning group and your primary care setting, you will also have regular one-to-one feedback with your tutor. Often these are very supportive measures, and your tutor is able to give you guidance on what you're particularly successful with. But as we all know, there's always areas for development, and again, they're able to give you some tips about aspects of your study which you may need to refocus on, so that you really do meet your potential throughout your course. As I've already mentioned, one of the defining features of our course is that you do spend one day a week in a GP practice. Now, this isn't about learning to be a GP, although obviously we do support students who want to become GPs, and many of our graduates do work as GPs. But it's really reflecting on where care for patients takes place now. The stays in secondary care tend to be very short, and as soon as possible, patients are sort of discharged and are then cared for by their GP and in the community setting. So it's about having opportunity to almost follow the patient, really. So the way that it works is you're one day a week in primary care. You will very much get a chance to meet patients with that particular condition. So, for example, In year one, if you are looking at rheumatology and you are looking at patients, say, with rheumatoid arthritis, so during the campus week, you're learning about the pathology, the physiology, some of the treatments. When you're actually with the GP, they will bring in patients with that condition. You will have an opportunity to meet them, to undertake examinations, and really to talk to them about what it's like to have these conditions long term and how they manage those. So often one of the questions that we get is, how does it look? What does a typical week look? So in year one, this is taken from week 4. So as you can see, it's a fairly full timetable. There is a lot of material to cover. Everybody acknowledges that studying medicine is hard and it's a busy timetable. So as I said, typically Mondays and Tuesdays are often where we try and guide you with the knowledge that you need for that particular week. We can do that through lectures or seminars. It may be an online task that you need to do, but really that's when we try and guide the knowledge for that week. We undertake consultation skills training. So again, in your small group, you work with a facilitator and an actor where you have an opportunity to practice those skills before going into the clinical setting. Wednesday mornings are typically anatomy, where again you're doing your small group teaching. We try and keep Wednesday afternoons free from years 1 to 3, really, so you have a chance to participate in any sports that you might have an interest in. UEA has a really vibrant student union, lots of different sports activities, arts, music, pretty much any activity you might have an interest in. And we really encourage our students to participate so that you have an opportunity to unwind and really do something for yourself. As I mentioned, you spend 1 day a week in primary care, which is typically a Thursday, and then a Friday morning is where you spend your time doing problem-based learning. And again, typically this is a 3-hour session a week, and this is where you have a chance to look at particular clinical cases, brainstorm, try and pick out key features to really guide your learning for the following week. So as with all medical schools, you do spend a lot of time in your in secondary care hospitals, and these are a list of our core partners. Now, during this time, you will undertake a range of structured teaching. That may be clinical skills teaching, assessment of patients, but also you will spend time undertaking clinics, ward rounds, theatres, and you work really closely with consultant and their team of clinicians, as well as other health professionals who will really guide your learning so that you have an opportunity to really apply the knowledge that you gained during your campus teaching into that secondary care setting. So again, one of the questions we often get asked is, what does secondary care placement timetable look like? One of the key differences with our course is that, again, our students do go into hospital placements in year 1. Typically, you will spend between 8 to 9 weeks in secondary care. Now, we acknowledge that in year 1, you're very junior students. Your knowledge is still very new. So this tends to be much more structured. So this is a typical timetable that our year 1 students follow. So lots of structured teaching where you go through clinical skills, joint examination, you may look at gait, but also you will spend time in theatres, in clinics, meeting patients. Now, as you progress through the course, the structure becomes slightly more relaxed, where you are able to go into ward rounds, undertake your assessments, and that really builds up. So by the time you are in year 5, you are pretty much working in the hospital full time, very, very closely with the foundation doctors and the registrars and the consultants, ready for when you make that final transition into your junior roles. Now, we do try and provide our students with choices and opportunities really to stretch themselves. So we do obviously run our student selected studies, and we have a huge range of subjects that you're able to select, everything from plastic surgery to environmental sciences. Something that you have a particular interest in, you're able to choose your subject and spend a period of time studying that subject. We also offer medical humanities, and also we do encourage our students to undertake an intercalated degree at the end of either year 3 or year 4. We offer a range of intercalated options at UEA. We have a clinical academic who leads our intercalation work, and he provides support for all of our students very much from year 1 to sort of start talking through the different options, what type of degree they may be interested in, whether they wish to stay at UEA or whether they want to use the opportunity to study at another medical school, how they make the applications, the funding around that. So there is lots of support to help you. And then again, we do also have our elective opportunities at the end of year 4 and year 5. We are a research-intensive medical school. So as I previously mentioned, our research methods theme runs throughout the 5 years, very much developing all of the skills you need as a GMC registered doctor. We do have some fantastic research facilities on campus. As I mentioned, we have the Bob Champion Research and Education Building. We are part of the Norwich Research Park. And we have several research themes that our academics focus on. Again, if you have a particular interest in those areas, you are able to work with those groups, and students during their student selected studies get involved, and we've had students publish through their student selected studies, and obviously if they do a intercalated degree with us, they also publish through those routes as well. I also just wanted to touch on our assessment strategy. Now, as you can imagine, we do a range of both formative and summative assessments. Our formative are very important to provide ongoing feedback for our students, as well as the summative assessment. Typically at the end of each year, all of our students must pass both their written paper, and there is also an end of year OSCE. As I mentioned, we are an integrated course. We are a systems-based course, so we do assess those skills as we go through. But also we have student selected studies, we have the medical research themes, but also we have assessments such as reflective portfolios and case-based discussions, which are where you assess particular patients in primary and secondary care. One thing I also wanted to touch upon was the medical licensing assessment, the MLA. Some of you may have heard this phrase when looking into medical schools, when doing your research. Now, the MLA is going to be a new assessment which has been introduced by the General Medical Council, and for any student at the moment who is completing their degree in 2024 will need to take the MLA. Now, it will compose of 2 parts. There's what we call the applied knowledge test, which is, as you would expect, a knowledge test that it will be set by the GMC and held at each medical school. And then there will be an assessment of your clinical and professional skills, known as the CPSA. Now, at the moment, the exact details of these are still being worked through, but if you study medicine at UEA and you need to undertake the MLA, then it will be a core component of your medical degree as well. There is, like I said, the details are still being finalised, so please do regularly check for updates if you have any concerns around this. Finally, I just wanted to touch upon student health and wellbeing. We take the health and wellbeing of our students incredibly seriously, and we have various mechanisms in which we both encourage our students to adopt a healthy lifestyle, but also to try and be proactive with any issues that might arise. So as I mentioned, part of the rationale around the small group teaching, not only is this about developing your academic skills and your interpersonal skills, but it does also provide us with weekly opportunities to check in through your GP tutors, your PBL tutors, and you're able to develop those really good relationships. So hopefully if there's anything that arises, you feel that those people are there for you and you can talk to them. You are also allocated a personal advisor, as well as we have senior advisors and year leads who again are able to meet with you, provide you additional support and essentially signpost you to other services should you need them. We also have a wellbeing lead in the school who is actually a clinical psychologist by background, and she works in two ways. She's able to provide more intensive support for students should they need it, but also it's looking at how we can be proactive with our wellbeing and look at strategies to identify where we may be stressed, where we may need to change our behaviour, and really embed some good habits. So when you qualify and you become a doctor, those habits will last you throughout your career. We also have a university student services that we work very closely with, and also if you do have a disability of any type that you are concerned about, then please do get in touch with us. The General Medical Council have recently published their Welcomed and Valued guidance, and it's very much about supporting students and colleagues who have a disability in medicine, and we very much follow that guidance. So please do get in touch with us if you would like to ask us specific questions. Now, I've talked an awful lot about what we provide as a medical school, and this is very much about what we need from you. So, of course, we absolutely need enthusiasm to learn and passion for medicine. Medicine is a long course and it's a long career, and we really need that there. And if you have that, then you are going to be set for life. You absolutely have to be curious to study medicine, but particularly at UEA, because of the way that we structure our course with our small group learning, problem-based learning, you need to want to ask questions, you need to want to find out things. And as I mentioned, because of the small group working, you really do need to be able to learn from and share with your colleagues. We need you to be prepared to discuss, to talk about issues. We will support you in your development to do that, but we do need that inquisitive mind from the outset. We do need a professional approach. So again, professionalism runs throughout our whole 5 years, and we do need you to be professional. We need you to be on time, we need you to engage, and we need that maturity from you from day one. And finally, do make the most of all of your opportunities. There's so many opportunities both in the medical school. We have a fantastic medical school society that runs lots of different courses, lots of different societies, have lots of opportunities to get involved, but also across the wider UEA community and beyond. And finally, this could be you. This was our graduation 2 years ago when all of our students graduated at Norwich City Football Ground. Finally, just to thank you for taking time to listen to this presentation. I hope you found it informative, and we hope to welcome you soon.